Urologist, 7 masturbation mistakes after 60 that are silently harming older men, advice for elderly. Aging brings wisdom, patience, and often more time for reflection. But one subject that older men rarely discuss openly is sexual health after 60. Many assume that intimacy or self-pleasure should fade with age. Yet, according to urologists, this isn't true. In fact, masturbation can still be healthy for men well into their 70s and 80s, if done the right way. Unfortunately, many elderly men unknowingly make mistakes in how they approach it, leading to discomfort, health risks, or even long-term complications. Below are the 7 most common mistakes older men make when it comes to masturbation after 60, explained by urologists, and how to correct them for better sexual and overall health. 1. Ignoring changes in blood circulation and heart health. After 60, the body's circulation naturally slows, and erectile function depends heavily on blood flow. Many older men ignore this reality and try to masturbate with the same intensity they did at 30 or 40. Why it's harmful? Sudden strain on the heart, elevated blood pressure, or vascular stress can increase the risk of dizziness, palpitations, or even cardiac episodes in men with heart disease. Urologists' advice: slow down, take your time. Gentle stimulation with breaks is far healthier than rushing. Masturbation should never feel like exercise. If you notice chest pain, shortness of breath, or extreme fatigue, stop immediately and talk to a doctor. 2. Using no lubrication. In youth, natural lubrication and skin elasticity make friction less of a problem. But after 60, skin becomes thinner, drier, and more fragile. Why it's harmful? Dry masturbation can cause micro-tears in the skin, soreness, or infections. Older men also have slower healing times, so minor injuries can become lingering problems. Urologist's advice: always use a gentle, water-based or medical-grade lubricant. Avoid petroleum jelly or products with perfumes, which can irritate delicate skin. 3. Ignoring prostate health. The prostate is the silent player in male sexual health. After 60, the majority of men experience some degree of prostate enlargement, BPH. Unfortunately, many don't connect masturbation habits with prostate wellness. Why it's harmful? Long periods of abstinence or too much pressure during masturbation can worsen prostate congestion. This leads to pain, difficulty urinating, or frequent nighttime trips to the bathroom. Urologist's advice: regular but moderate ejaculation can help keep the prostate fluid circulating, reducing discomfort. But if you feel pelvic pain or urinary symptoms, seek medical advice instead of ignoring it. 4. Comparing performance to younger years. One of the biggest mistakes is mental, not physical. Many men over 60 still expect their erections, stamina, and recovery time to be like they were at 25. Why it's harmful? This creates anxiety, frustration, and feelings of failure. Stress, in turn, worsens erectile difficulties and lowers testosterone levels. Urologist's advice: redefine what pleasure means. Focus on relaxation, sensation, and enjoyment rather than performance. Masturbation after 60 is less about speed and more about connection with your body. 5. Overuse of pornography or unrealistic stimulation. With the rise of technology, many older men turn to pornography for stimulation. While it can be harmless in moderation, excessive use can cause problems. Why it's harmful? The brain becomes desensitized, making it harder to get aroused by normal touch. Porn can also create unrealistic expectations of what erections should look like at 60+, leading to self-doubt. Urologist's advice: try fantasy, memory, or sensual touch instead of relying only on explicit videos. Keep the focus on natural arousal, not artificial overstimulation. 6. Neglecting pelvic floor and core muscles. Few older men realize that the same muscles that support bladder control also influence sexual function. Masturbation without attention to overall pelvic health can weaken this system over time. Why it's harmful? Weak pelvic muscles can lead to urinary leakage, weaker erections, or difficulty achieving orgasm. Urologist's advice: incorporate Kegel exercises, contracting and releasing pelvic muscles daily. This strengthens the base of sexual health and improves erectile quality, stamina, and bladder control. 7. Treating it as a shameful secret. Perhaps the most silent mistake is psychological. Many older men feel guilty, embarrassed, or too old for self-pleasure. They hide the habit, deny themselves the benefits, or practice in unhealthy ways because they rush. Why it's harmful? Shame and secrecy increase stress and depression. When men suppress sexuality, it can worsen loneliness, reduce testosterone, and even impact mental health. Urologist advice: accept that masturbation is normal at any age. It helps release tension, improves sleep, maintains circulation in erectile tissue, and supports emotional well-being. The key is balance and mindfulness. Final words from the urologist: masturbation after 60 is not dangerous, but the way it's practiced makes all the difference. Done correctly, it supports prostate and heart health, reduces stress and helps sleep, maintains erectile function by keeping blood flow active, boosts self-confidence and emotional well-being. The problem arises only when older men ignore their changing bodies and continue with old habits. By avoiding these 7 silent mistakes, men can continue enjoying intimacy safely, comfortably, and without guilt well into their later years. Remember this truth: sexual health is part of overall health. Just as you adapt diet and exercise with age, so too must you adapt your sexual habits. The goal is not to copy your younger self. It is to live with balance, dignity, and joy at every stage of life. Hit that subscribe button and join us on a journey through the timeless wisdom of the older generation. Don't miss a single life-changing lesson.